Hey guys, it's Dr. Justin Marchegiani here. Today's video, we're going to be chatting about histamine and histamine medications as a way to address histamine problems and why it may not get to the root underlying issue. So, all right, let's dive in. Before we do, put your comments down below. Want to know what your experience with histamine symptoms, and what you've done about it. Really curious. And make sure you smash that like button. Really helps the YouTube algorithm. All right, so let's dive in. So histamine is actually a neurotransmitter made in the gut, made by the amino acid histidine. It's a neurotransmitter. It's designed to help with vasodilation in a lot of areas, to help with inflammation and blood flow. And a lot of people, their histamine buckets, their stress buckets are so overflowed, right? They're so stacked up that they're overflowing with various stressors, whether it's food or gluten sensitivity or infections or low stomach acid, poor digestion, gut bacterial overgrowth, that now histamine from food or histamine production from environmental allergens is actually creating symptoms. Now, some common histamine symptoms can easily be difficult breathing, faster heart rate. More common ones would be like urticaria or hives on the skin. You can also see cognitive issues like brain fog and headaches. You can even see it in the skin with a condition called TMAP, where you see these little white patches from the histamine accumulation of the various mast cells. So these are all common symptoms and common issues. Now, there's a lot of medications. You have basically H1 blockers, H2 blockers, histamine receptor 1, histamine receptor 2. Okay, you have things like, Pepcid AC, which are going to be on the histamine side. You have medications like Benadryl, right, or Allegra that are going to be histamine, whether it's H1 or H2 receptors. They modulate that receptor site. They have a lot of side effects, though. They can cause drowsiness, fatigue, brain fog as well. Sometimes the symptoms can be worse. You also have corticosteroids like Singulair or various corticosteroid medications, all the way up to prednisone when it's significant, to fix a lot of these issues. Now, the problem is with these H1, H2 blockers, histamine is actually necessary to stimulate hydrochloric acid production. So here's the major mechanism. The longer that you are taking antihistamine medication, whether it's H1 or H2, they're actually going to lower stomach acid levels. Now, when you lower stomach acid levels, you naturally lower internal enzyme production, because we need stomach acid to activate pepsinogen to pepsin, right? These are proteolytic enzymes. We need that nice low acidity in the stomach, pH of around 1.5 to 2.5. When that food or that chyme goes into the small intestine, that stimulates the gallbladder to produce bile, because this compound called CCK, cholecystokinin, needs a nice acidic pH. That also triggers the gallbladder to make the bile, like I mentioned. It also triggers the pancreas to release more protease, which are protein breaking down enzymes, and lipase, which are lipid breaking down enzymes. So fat digestive enzymes and protein digestive enzymes. So if we're chronically taking these histamine medications, we're going to lower stomach acid over here. That's going to affect digestion. That's going to affect enzyme production from the pancreas and bile production from the gallbladder. Also, acidity is really important to prevent a lot of bad bacteria from growing. A lot of the reason why bad bacteria grows is because a high pH can happen in the stomach. You see it at all with birth control pills creating more yeast infections, because the high levels of estrogen can actually create a more alkaline pH, which makes it more hospitable for bad bacteria, which could increase UTI via E. coli or yeast infections via Candida. So you can see this whole pH shift from the stomach down the intestinal tract can really increase the chance for microbes to grow. It can also decrease stomach acid. When stomach acids decrease, it's going to make it harder to break down protein, harder to break down fat. When we have poor digestion like that, now we have an increased risk for food allergens. Now we're reacting more to the food. We increase our gut permeability. Now our immune system's on high alert. And now we're starting to create SIBO, because we have food allergens, we have indigestion, we're not breaking things down, foods are fermenting, putrefying, and rancidifying. We have a relatively more alkaline pH than what should be, because these medications are decreasing our ability to make stomach acid, meaning decreasing stomach acid means increasing the pH closer to neutral. So you can see all these different downward cascades now that can occur when you're on these medications. So it's very important to understand, when you take something, what's the mechanism? What are you doing to your body from a biochemical mechanistic standpoint? Is it addressing the root cause? If it's not addressing the root cause, well, it's okay if we have palliative support, but we have to look at how we're also addressing the root cause at the same time. We want to look at it, okay, root cause, get to the underlying issue. That may take longer. Hey, palliative support, I want to feel better in the moment because I have all these allergy symptoms. So we have to kind of balance the two. Now, I did an in-depth podcast on this topic, so feel free to take a look. We'll put the link down below in the next day on that in-depth podcast that we did yesterday on YouTube, where we talked all about the underlying mechanisms of histamine issues and what is driving the underlying problem. Now, a lot of people look at histamine as an issue in and of itself, right? They have to go to the H1 or H2 blocker, right? The Singulair or the corticosteroid Singulair, the Allegra, the Benadryl, the Pepcid AC, right? They're going to these medications thinking that they're fixing the problem, but they may not be. And then also, it's very easy to forget that the gut is going to be the major place where a lot of this happens, because that's where 80% of your immune system is. And if your immune system is chronically being stimulated from food, from poor digestion, from food allergens, from infections, then your immune system will chronically be hyperstimulated, and it will be reacting to every single food particle that comes in, every higher histamine food, even if it's citrus foods or good healthy fermented foods like kombucha or sauerkraut. Your body may be responding to it negatively, meaning you're getting stuffed up, you get dizzy, you get headaches because of the fact that your body is hyper responding to these foods where it shouldn't be. So we got to get to the root cause. So feel free to reach out to me down below if you want to dive in or connect with me personally. I see patients all over the world. I have colleagues that help as well. Really excited to dive in and answer some of your questions on the topic. And feel free to take a look at that podcast where we dive in a little bit deeper. All right, what's on your mind today, guys? Let's see. Okay, a couple of questions here, maybe a little off topic. We'll roll through. Dr. J, after a tooth extraction, what can I use in place of antibiotics to prevent infections and how to use it? I don't want to kill my good gut bacteria. So first thing you can do off the bat is you can do oil pulling. So you can flush with coconut oil for about 10 minutes. The fat being swished around the mouth will pull toxins out from that area, and then you can spit out that coconut oil. Don't swallow it. There's a lot of toxins now in it. That's number one. You can get a really good high-quality mouthwash. A brand, Young Living, makes a brand called Thieves. They have a really excellent mouthwash that's really good. You can also use some colloidal silver or a nano silver. In my line, we have a product called GI Clear 3. You can flush with that. And then you can also do 3% hydrogen peroxide. You could always dilute a little bit of water and gargle that accordingly. That's perfect. Can stimulant psychosis, i.e. psychosis following stimulant use, turn into schizophrenia? I don't know about that. I can just tell you schizophrenia is going to be on a spectrum of psychological issues, and almost all psychological issues have some degree of inflammation involved in it, some degree of B vitamin deficiency. We know B6 is very important with psychological issues because B6 helps the synthesis of a lot of your brain chemicals, serotonin, dopamine. So if you're stressed and you're burning these things up, or if you're an alcoholic, you're actually going to create functional B vitamin deficiencies, because when your body metabolizes alcohol, it needs B vitamins to do it. So it's kind of like using a credit card with a really expensive transaction fee and you can't pay it off every month. You're going to go into massive debt. So it's kind of like that. And then also Emily Deans has written articles about gluten sensitivity and schizophrenia. So there's a strong connection between gluten, leaky gut, inflammation in the gut, and inflammation in the brain in a lot of these psychological issues, for sure. Is nettle tea good for histamine use, and is it good for anything else? Yeah, nettle tea is excellent for histamine. So is bromelain. So is, I mentioned stinging nettle already. So is quercetin. You can also do NAC as well. Dennis writes in, I heard a PhD nurse say that malnutrition in children can lead to hypertension in adulthood. Is that true? I mean, malnutrition in children can lead to every single condition out there. Your body needs nutrients to run. And I can tell you, having two kids, 2 and under, most kids eat absolute crap. They do not eat good fats. They do not eat good proteins. They do not get enough good high-quality organic vegetables. They do not get enough organic food to begin with. They get lots of pesticides. They get lots of sugary crap, lots of dyes, lots of colors, artificial preservatives. Kids should be getting good protein, good fats. If they can't do vegetables, like I get my kids to do some organic green vegetable juice, which helps. They don't love vegetables, so we'll try to do some. We'll steam some vegetables. We'll put some butter on it and sea salt. That helps. We'll do some good, clean, organic vegetable juice without any added fruit. People forget that if you do a lot of juiced fruit, you can have more sugar than a Coca-Cola. Even though there's nutrients there, there's still a lot of sugar, and that can cause your kids to be hyper-stimulated and get jeeped up. Okay, great. Any difference in superiority in using liposomal vitamin C? It just depends. Liposomal vitamin C is going to be great. There's a lipospheric vitamin C I like. Can be very helpful without causing the bowel issues. Do you like applied kinesiology? Is it credible in diagnosing health conditions? I do like applied kinesiology. I used it more on the chiropractic side for musculoskeletal issues to see which muscles were inhibited or facilitated, turned on or turned off. I don't love it for nutritional changes just because muscle testing gives you a snapshot in time. So if you come in and get adjusted or get muscle tested and you have low blood sugar or your cortisol is spiking at the moment or you didn't get good sleep the night before, how you're going to test there would be totally different maybe 3 or 4 hours later. And so then if you're basing programs off of a snapshot in time, it's really tough because you're not getting a good window into where your physiology is on average. So you have to take that into example. And a lot of people that do muscle testing, their program's changing all the time, and it becomes really difficult. And then they can say, hey, look, I tested strong for gluten. I can eat gluten. It's, well, that's not necessarily, you know what I mean? You can kind of use it to justify certain things, and the program just moves all around. I think there's some benefit in it, though, but it's really tough creating longer programs for it. So yeah, can MCAD, I think that's mast cell activation disorder, right? That's where kind of the extreme histamine loss is. That's where the extreme histamine production is. Can that cause tooth loss? Any way to prevent? Would histamine drive tooth loss to begin with? I would say it'd be more of the inflammation that would be driving the tooth loss. So what's driving the inflammation? Probably refined sugar. Grains are going to be one of the biggest things that can drive cavities. If you listen to Dr. David Kennedy, he'd say when he was in dental school, they would, when they were working on doing, practicing their cavity filling on cadaver mouths, dead animals or rats or things like that. They would say the fastest way to get a tooth to get a cavity is they would drill it and put some gluten in there, and it would just eat away at the teeth. And again, a lot of that is because the bacteria in the mouth would eat a lot of that food and ferment a lot of acids that would erode the enamel. And I'm not sure if those were alive, if those were animals that were alive or dead, but he talked about that in a couple of interviews I listened to him on. Let me go head over to Facebook, give some Facebook love. Ashley writes in, I took a break from taking Megaspore. Within a month, I started flushing while drinking wine. Never had an issue with histamine before. So it just depends. I mean, people as they get healthier, sometimes they can be more sensitive. Like if you don't drink alcohol for a couple of months, you get a buzz when you have one drink. It doesn't mean your liver is more toxic, right? It just means your body's more in tune. So it may be a new issue. It may be not. It may just be your body's more sensitive. So just if that's the issue, definitely cut out the wine and choose a lower alcohol, lower sugar, or lower sugar alcohol, cleaner alcohol in the meantime. Alcohol does two things. It increases histamine release in the body, and it also decreases the enzyme that breaks down histamine called diamine oxidase. So it's a double whammy. So you can combat it by doing extra DAO enzyme when you do alcohol, but a lot of Asians, for instance, miss that enzyme, so they do a lot of Pepcid AC preventatively because they get flushed because of that H2 enzyme genetic issue. So again, if that's the case, I would just cut out that alcohol for a little bit, Ashley, as you continue to get the gut better. Let's check in real soon, okay? Let me keep on rolling, y'all. I've read the SFA, I think you mean short-chain fatty acids, are potentially inflammatory due to their similarity to bacterial lipopolysaccharide. Is there an issue with eating butter? So butter, I think, is what? That's like a 6 carbon? So that's a shorter chain fatty acid, I think. I think you hit medium chain fatty acid once you get to C6, right? I think C4 is butter. Yeah, that's how many carbon molecules are in the fatty acid. I'm not worried about that lipopolysaccharide and fats. I'm just not. The biggest preferential fuel source for dysbiotic bad bacteria is going to be acellular carbohydrate, refined grains, refined sugars, processed foods, all of those good things. All right, Ashley, that's great. Yeah, I look forward. If we can connect sooner, that'd be awesome because I want to get you onto that next step with your hormones in your gut. I can't recall exactly where you're at now, but I think we have to work on that gut component, or we're on the end of that. So look forward to checking with you soon. Okay, let me keep on rolling, guys. If there is an allergy, respiratory, mold or fungus, parasitic, adrenal, and other immune issues going on all at once, and food is dialed in, low carb, what test is the first step to start healing? So I always like dealing with the adrenals first because that's where we decrease inflammation, and that helps with gut permeability, that helps with energy, that helps with recovery, right? When people have serious allergy issues, what are they doing? They're going to Singulair or corticosteroids. Your body has its own corticosteroids called cortisol from your adrenals. We got to make sure that is dialed in and supported. If you're a female, progesterone issues can easily be a problem. With lower progesterone, that's going to make it harder to deal with inflammation because progesterone itself is a natural anti-inflammatory. So if you have estrogen dominance, low progesterone, and weak adrenals, now you're really in a difficult place to deal with allergies. Excellent. Let me keep on rolling, guys. Tips for avoiding carpal tunnel or other repetitive injuries. Well, just try to keep your wrists more neutral. Good quality mouse, and keyboard that's going to be more, that's going to support better posture. Also, really good chiropractic and or massage care to keep the tissue really pliable. The more inflammation you have, the more your tissue becomes beef jerky over a soft tenderloin, soft, spongy tenderloin, right? Beef jerky tears, tenderloin absorbs and bounces, right? So you got to keep your tissues nice and soft and supple. You can't have issues in the tissues because of inflammation. Why do I have muscles twitching all over my body, inside my ears and tongue? So you're definitely not getting enough minerals. Look at magnesium and potassium and sodium and chloride. Friend started coughing 4 weeks ago. Off of bronchitis diagnosis, has not stopped except when he lays down, sleeps well, but as soon as he gets up or moves, cough attack begins. Doing ginger and sinus rinses. That's great. That's awesome. I would also add in some NaC to see if there's any excess mucus up in the sinuses that's causing a post-nasal drip that's also driving it. And I would really make sure all the sinus stuff from the allergens is dialed in. Really good high-quality air filter too. Do you really treat Lyme disease? How long have you been treating? I've treated Lyme disease for 10 years. The problem is most issues aren't Lyme disease. Lyme disease can be an issue if it's acute for sure, right? But then when you have chronic immune stress, now Lyme disease, i.e. Borrelia burgdorferi, different co-infections like Rickettsia, Babesia, Ehrlichia, these issues now become more of a problem, not because they're the actual issue, but because the immune system has become compromised and now it rears its ugly head, right? Like if you look at AIDS patients, right? Candida and fungus can kill them, right? But the average person won't get killed from Candida. Why? It's because your immune system has to get weak enough where those microbes can become a problem. And it's the same thing in Lyme. Of course, there's acute Lyme issues that have to be dealt with, more immediate, right? You get a tick bite, etc., bullseye rash, or you start having symptoms right away, fine, address that acutely. But the problem is other people that have chronic Lyme issues, they're being put on by these ILAD doctors, antibiotics for years on end, and it just screws up their microbiome, and then it screws up their immune system, and now they have more side effects. And a lot of the Lyme symptom side effects can mirror antibiotic side effects. So you have to be careful with the antibiotics actually driving a lot of the Lyme symptoms. So you need a really good sequence, and you got to fix the gut first. I've seen so many Lyme patients that have had H. pylori and blasto and gluten sensitivity and adrenal issues, and they haven't had those issues addressed yet, and their doctors are just literally going after the Lyme and pounding them with antibiotics. It's really scary. Can MCAD cause bone loss? I already answered that question above. I wouldn't say that issue. I think the MCAD is an effect, not a cause, right? You're framing it, Kara, as it's a cause. MCAD is the effect of inflammation gone wild. You got to look at the cause of that inflammation, whether it's infections, food, etc. Is there a technique or a protocol for managing Herxheimer's with mold? Insomnia is my biggest problem. Yeah, so number one, make sure you're always dialing in the adrenals and the gut and the food and the inflammation and the water and all the lifestyle things before you go after any of that crud. Number two, make sure you taper into it slowly. I always lean in with more binders and more drainage and ginger and high quality things to gently help with inflammation and drainage before I go after anything heavy duty. Hope that helps. All right, guys, phenomenal chat, and I'll try to pop back on later on today. Let me know what content you're liking, what you want to be hearing more of. If you enjoy it, give me a thumbs up and a share. Make sure your family can see this so they get the support that they need. And I want to be here for you guys. I know with all the craziness in the world today, we need our health. We need our health so we can keep our wits about us and perform and do well at our jobs and be there for our family. It takes energy to do it all. So I hope you guys keep doing the right stuff and keeping yourself healthy. All right. Take care, y'all. Bye.